Hello, I'm Dr. Rohini. Today I'm going to briefly talk about what is recurrent pregnancy loss or recurrent miscarriages and what are the common causes of recurrent miscarriages. So, what is recurrent pregnancy loss or recurrent miscarriages? So, whenever a patient has repeated abortions, that is around 3 times and less than 20 weeks of pregnancy, then we consider it as recurrent pregnancy loss or recurrent abortion. What are the common causes of recurrent pregnancy loss? The one of the major reasons is genetic abnormality. When there is a defect in the genetic makeup of the baby or the genetic makeup of the parents, then it may cause a recurrent pregnancy loss. Around 50% of recurrent pregnancy loss is because of these genetic factors. Now, another common cause is age factor. As the age of the parents increases, the chances of recurrent pregnancy loss also increases. When the woman is less than 35 years, then the chances of recurrent pregnancy loss is around 10 to 15%. But at the same time, when the age of the woman is more than 40 years, then the chances are around 50%. Now, there are other causes also, like there is any abnormality in the shape of the uterus. There are some types of uterus where something called septate uterus or biconvate uterus, where the shape of the uterus itself is different from the time of birth. This can also cause recurrent abortions or miscarriages, but this usually causes abortions after 3 months of pregnancy. Now, there are other conditions which may affect the blood clotting system of the body. That is like APLA, that is anti-phospholipid antibody syndrome, protein C, protein S deficiency. So, what happens in these diseases is that the blood in our body there is more stickiness in the blood. There is increased chances of blood getting clotted. So because of this also blood supply to the baby gets affected, and the woman will have recurrent miscarriages. There are other endocrine or hormonal changes also which can cause recurrent miscarriage, like the presence of diabetes with uncontrolled sugar, that can also cause miscarriages. Hypothyroidism, that is reduced thyroid levels in the body, and also some hormonal abnormalities like polycystic ovarian syndrome, that is PCOS, increased prolactin levels. These are some of the hormonal abnormalities that can also cause this. And sometimes there are some lifestyle factors also which may contribute to this recurrent abortion, like if the person is obese, has a higher BMI, or is very undernourished, or if the person does a lot of excessive strenuous exercise, and otherwise the person is a chronic smoker, or if the woman is consumes a lot of alcohol or lot of caffeine. So these kind of lifestyle factors also contribute to the abortions. Another cause of recurrent pregnancy loss is abnormal or bad quality of sperms. If the sperm quality is not good, that can also contribute to recurrent abortions. So even apart from the female in the couple, the male also has to be evaluated if they have problems in the sperm. There are certain tests called DNA fragmentation index which we do to find out if there is any abnormality. So these are some of the common reasons why recurrent miscarriages happens. So in one of my next talks, I will talk to you about how we are going to manage a woman who has these conditions or who presents to us with recurrent miscarriages.